Today is Money Saving Monday, and we are taking a look at healthcare and how you can save money on the rising costs of prescription medications. The stats really are alarming. According to KFF Health Tracking Poll, 6 in 10 adults are taking at least one prescription medicine, and 3 in 10 say they haven't taken their prescribed medicine due to all the costs. So let's talk about it. Joining me now is Dr. Natasha Bhuyan, National Medical Director of One Medical. Great to have you as always. Okay, first off, you say there are certain things that you need to talk to your doctor about. Aside from talking about just getting generic medications, you also say ask for a 90-day supply. Why is that better?
Yes, so buying in bulk often saves money, and the same is true for medications. And so many doctors will write for 30 days with 11 refills. Ask your doctor for a 90-day supply. Oftentimes, it's actually cheaper than 30 days. And of course, ask for generics. The other thing we talk about is asking for oral medications over creams, pills, and injectables. So creams, patches, and injectables, they often cost more than pills.
I had no idea.
Yeah, and in some instances, the pill actually makes sense to take. So talk to your doctor about if that is safe.
This is new too, because one of my son, he takes a pill, and the doctor, it's very expensive, and the doctor says, you know what, you may want to get a higher dosage and split it in half.
Yes, yeah. In some instances, that is safe to do because there's some medications that come scored, so you can split the pill in half. So for example, if you're on 10 milligrams of a medication, you can ask your doctor, can you write 20 milligrams? And in the instructions, just say, take a half a tablet. That'll last you longer.
Yeah, that's huge. Okay, another big thing that people can save money on, know your coverage and benefits. And you say you need to understand your insurance and formulary options. What does that mean?
Yeah, insurance can get confusing, your benefits can get confusing, but one important thing to know is your formulary. So if you have, 2 generic medications, they're not always the same price. So depending on your formulary and the tiers, one generic might be tier 1. That's the one you want to get. So it's important to look at the medications you're on and then look at your insurance coverage and ask your doctor for the tier 1 formulary options. The other thing to understand is HSA and FSA benefits. So those are great because you can often get over-the-counter medications that you would typically pay out of pocket for get covered by your HSA or FSA.
Yeah, I use that card a lot.
It's a great option.
It really is money saving. Okay, you say research pharmacies. What do you mean by that?
Yeah, there are so many pharmacy options out there nowadays. So I know a lot of people are used to going to the pharmacy around the corner in person, but now there's mail order pharmacies and online pharmacies, and oftentimes those are actually more affordable than going in person. And so it's good to look at all the different options. We've also known that a lot of pharmacies will try and price match, and I love that for local or independent pharmacies. They want to get you the best price, and so ask the pharmacist, is this the best price you can offer? And there is sometimes wiggle room to change.
So online pharmacies like GoodRx or something like that, right?
Yeah, so online pharmacies, there's a lot of them. So Amazon Pharmacy, Walgreens, there's Mark Cuban's Pharmacy as well. There's a lot of new online pharmacy options.
Okay, all right. You also say you need to use coupons. And I've seen, the manufacturer direct coupons before, but you say search for online coupons and discounts. Give me some examples.
Yeah, so online coupons, that was what you mentioned. So GoodRx. Needy Meds, Single Care, those are great websites you can go to. Type in your medication, type in your dose, and it'll come up with all the different pharmacies you can go to, and they'll compare prices. The other thing I like about those coupons is they'll actually tell you what is the price when you don't have insurance. So a lot of people think that your best price is with insurance, but oftentimes these days, not even using insurance might get you the best price for medications, which is pretty
crazy.
Unique.
Yeah, so ironic.
Yeah, and then there's also, beyond those coupons, there's also the direct manufacturer coupons if you're on brand name medications. There's also patient assistance programs. Those are run by different people. They often do ask for your income, but if you're lower income, they can give you some discounts as well. And then the last thing is different pharmacies have discount programs as well. Walgreens, Walmart, Amazon Pharmacy, they've all got their own discount programs, and sometimes it's just $5 a flat rate per month to get all of your medications that are eligible. And so it's important to research those pharmacy programs and see if they make sense for you.
Great tips. Natasha, thank you so much.